Yeah, so I'm one of the small animal vets here at Pride. I mainly work in the main hospital here at Pride Veterinary Centre on Pride Park. Sometimes I do some work at the branches, but mainly 95% of my time is spent here. So my day-to-day really, I'm a bit more surgically orientated, so I spend a bit more time dealing with cases that need workups, procedures that need doing, so x-rays, ultrasound scans, any operations that need doing, so routine surgeries like spays and neuters, any soft tissue surgeries that need going on, and some small orthopedic surgeries that might need doing. I've been here nearly 2 years in July. After my internship I was attracted here by the high level of facilities they have available, and my main focus coming here was actually to start doing emergency work, which I did. I spent about 9 months doing emergency work. I worked in the Vets at Night service as one of the night vets, and I really felt like it helped develop my skills a bit more, got my interests up for that aspect of work as well. So I still like to do a little bit of that if I can, but I'm now back into the daytime role as of July last year, so I've been back on days for about a year now. It's a bit more of a social time to work. When I first came for my job interview, it was mainly just the facilities. They're big and shiny. Really, you get an impression that things are of a high level here. And it really carries through when you get into the back and you see the level of care that can be provided to the patients that come in the door. And it doesn't matter if it's first opinion or referral, because the disciplines work side by side. The nurses deal with anything from a very simple post-op spay to the highly complex surgeries that they'd be doing on referral surgery here. So the level of nursing care here is second to none of any place that I've worked, really, and that's a real attraction for me as a vet. I know that I can leave my cases in good hands for them. Yeah, a big support network. I mean, the fact you can rely on your team is a big thing. You don't have to be checking in on them. They'll let you know if there's a problem, and if there is a problem, you better listen to them. So they're the kind of things that are quite nice. Just having the referral guys alongside you is great, but within our first opinion team, we have a great depth of knowledge as well. So there's great support structures among colleagues as well. Or memorable cases. I think memorable cases would have to be my very first GDV. It's an emergency surgery. It was an 80-kilo Irish Wolfhound dog. Came in at 12 o'clock at night. I'd never done them before. I knew the theory. I'd done them in practical courses. Getting a chance to do it was my first week of nights, and I was pretty green from that point of view. So it was a bit of a panic from my point, internal panic. Externally, I was told I was pretty cool about it, but internally a bit of panicky. But the case went great. Dog went home. Yeah, it was perfect. So it was kind of the fairy tale start to my emergency surgery journey, really. That one really stands out. Yeah, so they're very supportive here. We get a bursary every year to do some CPD. So my first year here, I was doing some building up my skills in certain things like ultrasound, and I was doing some CPD things now. But recently I've started a certificate in surgery. So they're very supportive. They're covering the cost of the certificate. So when I get time off to go and do it, so I'm 10 days out of the year I'm away on CPD, and they're covering things for me there. So it's been quite supportive, and it's been very progressive in that sense. They're encouraging really for you to do that work. Yeah, it's a good question. It's hard. It's different. As a first opinion practice, it's different to majority of places you're going to work, because the levels to which we can work up a case are quite high. It's busy, and the nurses have high standards of you as a vet. So you'll learn a lot from them to start off with, and it's quite hard to refocus your attention back onto learning from nurses again, because we do it when we're new graduates. But coming here, they know so much that you kind of have to take what they say and run with it a little bit. Apart from that, it's a very supportive team. Finding out if you have a focus of an area that you want to focus on more, if you want to do a bit more medicine or you want to do a bit more imaging, there's ways and means to move within the team, so you don't have to be a jack of all trades. You can focus a little bit within the team. The team as a general are very, they're a very social bunch. When we all get a chance, if we can, I mean, we're never all off together, but if we can, we try and catch up for some social occasions. Not always a drink, but a drink is often involved. But if you want to apply, I'd say you couldn't work in a better place in terms of the level of care you can provide to your animals, and if that's something you care about, then you should be sending your CV in now.